goal is to have a culture of health in America, then that means that we have to all come together.
Obesity is one of those issues that we really need to address as parents, within the schools, within the community.
1/3 of all of the adults in the United States are obese. 1/3 of all of our children born today will develop type 2 diabetes. Over $190 billion. That's more than 20%. And our healthcare costs each year are attributable to obesity.
Cross-sector work suggests to us opportunities to go beyond what might be normal partnering or normal day-to-day transactional behaviors and engagements, and to reach disciplines, institutions, bodies of knowledge that are beyond, in our case, media and education.
So when we think about the root causes of social disadvantage, because that is related to obesity, and then the causes of the causes, how we get to the point where we're eating too much and not being active enough, that's really spread across, the decisions are spread across a lot of different sectors.
So whether you're coming from manufacturing, transportation, urban design, education, information technology, this issue around obesity is everyone's issue.
Simply put, we just won't be effective if we focus our efforts in the medical office building. As soon as our patients walk outside of the medical office building, they are impacted by an environment that makes the healthy choice not necessarily the easy choice.
Philanthropy can't do it by itself. Public health can't do it by itself. Media can't do it by itself. The food and beverage industry cannot do it by itself.
Everyone has a part to play, when we need to think creatively of how that we can synergize those parts to work together for the greater good.
We think having Cookie Monster learn that a cookie is a sometimes food and regulate his behavior, being more patient, is a model that kids, as they adopt, helps.
But at the end of the day, it's about making the case that there is common ground and that there is value in working collectively, again, to achieve what might be different end goals for everybody, but they're all going in the same direction.
The great thing is that all of those different goals have convergent interests, convergent strategies, and that's where the real juice is.
No one entity has the resources to invest in a singular type of way to address the issue. No one. And so with that, everybody has to come together on this issue. It is solvable. It is solvable. It's complex, but it's solvable. And I believe that.
Well, greetings, everyone. How are you? Good. We are going to have some fun. These town hall meetings are always one of my favorite events. I'm Camille Miller with the Texas Health Institute. I'm the president and CEO, and it has been our distinct pleasure and challenge to hold the 8th annual Southern Obesity Summit. We've done this for 8 years in a different state each of the 8 years, and we will continue to do this till we get through all 16 of the southern states that are part of this collaborative. So thank you all for being here, and please remember that everyone here has something to teach and something to learn. Your perspective and your engagement is very, very important to the success and the outcomes of the event here. So thank you for being here. A few housekeeping things. First of all, Blue Cross Blue Shield of Texas, and do we have our representatives here? All right, Catherine is here, and Dr. Lopez was just with us with Larry Cohen in the pre-session a few minutes ago that just ended. Blue Cross Blue Shield of Texas, and then New Mexico and several other states are part of that as well, but they have been the single entity that has sponsored us every year in one way or another to produce this event in each of the different states. So let's give them a hand and thank them so much. Every year. A few housekeeping things. You all have anybody need to find a restroom? You haven't found one yet. There are some around the corner here and some around the corner there. If you need to leave a message or find someone, our registration desk is going to be in this same place where you picked up your badges and registered. And then there's a map in your agenda book of where everything is. We will be sending out an evaluation form after the event is over. It'll be a Survey Monkey kind of a survey. The breakout sessions, the bios, the key biographical information on all of the different participants are in that agenda. The contact information if you want to get a hold of someone you need at the conference is in there. We usually update that and post that to our website afterward. And then all the presentations that are being presented will also be posted. We are recording our plenary sessions, and those will be posted to YouTube just as quickly as possible. With a special thank you to the University of Louisville, Craig Blakely, I should know that, he came from Texas. And special thanks to Melissa Schreck for all their help. Let's give them a hand for helping us out. There is also the latest report from Trust for America's Health that you should have received in your packets when you picked up your registration material. We did not have enough for all participants, so the first I think 150 or 75 people got the report. Then for the rest of you all, there is a form in there to be able to get a hard copy of that report as well as it's available otherwise as well. There's information in your packets from Blue Cross Blue Shield of Texas on some of the obesity prevention efforts in regards to diabetes and their Be Well campaign. And we want to thank Kentucky's Coordinated School Health for helping us provide the bags, and a thanks to Jamie Sparks for coordinating that. Thank you so much. A little heads up on Monday, there is a run in the morning at 6 a.m. All right, we got a runner here. Meet in the lobby at 6 o'clock, and Jamie Sparks and Jessica Lawrence are going to be leading that group of runners. And it really may be cold, so be prepared that time of the morning. And then be sure and plan your day in terms of which sessions that you want to attend. We have expanded our lunch sessions this year. We had a great response to that last year. These are informal opportunities for you to hear from some of the experts and interact with them over lunch. So we'll have a grab and go lunch, so you can just grab a lunch and go find someone you want to visit with. We have an evening breakout poster session on Monday. And so again, if you don't get to attend all of the breakouts that you would like to, there will be presenters at those poster breakouts that you can enter into one-on-one dialogue with, and that was extremely popular as well. We do have continuing education units this year. You can get what you need for those by stopping by the HP Career Net table located in the foyer. I think it's right across from the registration. Social media this year. We want to encourage you to use social media during the conference. On page 8 in your agenda, your program agenda, we have information on how to Twitter, and it is hashtag SOS KY 2014. And special thanks to Eva Bland, the University of North Carolina Asheville Center for Health and Wellness, for all her work and for her tweeting about the conference. Let's give her a hand. Thank you so much. And then how about those exhibitors? Did you enjoy the exhibitor thing a few minutes ago? All right, okay. They have some great resources, and they'll be open until 7 tonight after this is over. And we'll have more healthy refreshments. And then Tuesday is awesome. We have a really great day planned with panelists and national speakers, and you will not want to miss that. A special thank you to our advisory committee. Thank you so much for all the work that you all have done. If you all will stand, you all that are on the advisory council, if you all will stand, let's give them a hand. Many of these individuals have served for multiple years, and we have at least 2 people from each state, each of the 16 states involved. They help us grow. They help us also bring continuity from year to year. And you'll find the entire list of that membership in your program. And then if you have questions, they have silver ribbons on. If you have ideas for next year, they see the people with the silver ribbons on. That's our advisory committee. And then you're going to hear more about our host committee in a minute, but you want to know anything about Kentucky or Louisville, they have black ribbons on. So thank them for their help with this, and they also will be a great resource for you. There are many factors that contribute to obesity. It's an almost overwhelming issue, especially for us in the South. So our ability to be active where we live, work, and play, our access to healthy, affordable food, the recognition of obesity as a disease that sometimes needs treatment, a work environment that encourages healthy behaviors, schools that promote healthy eating and physical activity, early child care environments that encourage our youngest Southerners to make healthy choices. Everyone needs these opportunities. And there are changes that are taking place in all of these areas across our 16 states. They're not taking place necessarily with equity, so we have some work to do in that arena. But everyone here is here because you care about your fellow citizens, you care about the people in your communities, and you care deeply, some of you for many, many years, about being a part of the solution. So, thank you again. We will be exploring many different ideas, initiatives, policies. We'll look at these different ideas from different lenses. And as you do that, take into account the socioeconomic factors, the cultural impacts, the inequities in food access, and physical activity opportunities. We know we have to focus on the family, on the neighborhoods, and on the communities to truly create what Robert Wood Johnson Foundation is calling a culture of health that encourages wellness and makes healthy choices. So thank you so much. As you attend the sessions of the next couple of days, take in as much as you can and give back as much as you can to each other. The dialogue among each other, the dialogue with the incredible resources that are available here is a bad analogy, but it's like a smorgasbord that's set for your taking of. And please be very mindful of the fact that whomever is sitting next to you has something that they can teach you and something that you can teach them. So our goal is to make this as much of an opportunity for you to learn from each other and to take back great ideas, and to also take with you a new, renewed enthusiasm for the hard work that we all have to do, and know that we can do it better together than we can alone. Thank you so much. And now I want to turn this over to our moderator, Bill Hacker. Where did he go? There you are. Bill needs no introduction to Kentuckians, but for the rest of us, it is my pleasure to introduce a true friend and a Kentuckian? Say that right? He's been a long-time member of the Southern Obesity Summit Advisory Committee. He's been incredibly supportive of us and a good coach on a number of issues. He's a native of Manchester, Kentucky. He was a private practice physician for many years. He accepted the position of Vice President for Health Services at the Appalachia Regional Healthcare. He left there in 1999 to serve as Medical Director of Kentucky Health Select, which is a managed Medicaid program serving Central Kentucky. In 2001, he joined the Kentucky Department of Public Health as a physician consultant in the Division of Adult and Child Health, and in 2003 was appointed Acting Director of the Division of Laboratory Services and served in that capacity until 2005 when he served as Commissioner of Kentucky Department for Public Health until his retirement in 2011. And then he will be joined by Carolyn Dennis. But Bill, if you will come up, let's welcome him as your moderator, and we'll get right to this fabulous panel. Thank you so much.